Tampa General Hospital is bringing world-class care to your door with urgent care at home powered by Fast Track. This innovative service is convenient for patients, and joining us today is Tampa General's SVP of Ambulatory Services, Adam Smith, and Dr. Paul Nanda, the CMO of TGH Urgent Care, which is also powered by Fast Track. Gentlemen, thank you both so much for being here.
Thank you.
This just seems, as we were chatting before we got started, like a blast from the past. We're talking about house calls again, right? How did this all come to be?
We're really excited about this. This was actually a conversation between our Chief Information Officer, Scott Arnold, and our CEO, John Corris. And really, Tampa General is looking to provide innovative health care and really convenient access in driving down the cost of health care. So one of the concepts that we came up with was house calls.
I think house calls, yeah, that's convenient for the patient, which of course is all great, but I want to get a doctor's take here. What were your thoughts on this program when you first heard about it?
Sure, so I've been interested in doing house calls in some capacity for a number of years, and in my previous jobs I was able to do some house calls as part of primary care. And in our new joint venture with Tampa General, it really gave us the opportunity to be innovative and try to extend that care into people's homes.
And you say this is actually the first that's being done here in the Tampa Bay area, which I think is worth pointing out as people get on board with this. Let's talk about the ways it improves patient care. I want to get both of your thoughts on this, as a matter of fact.
Well, we know as healthcare providers, the most inexpensive way to provide high quality healthcare is in the patient's home. So if we can bring that healthcare, the world-class care to patients' homes, we know that we're decreasing the cost of healthcare and providing it in the most comfortable and accommodating way right in the patient's home. Very convenient.
What services, though, are provided? What are you able to do in patients' homes?
Sure, so we can do most things that you can do at a regular brick and mortar urgent care facility. We can take care of common strains, sprains, and common conditions, especially going into flu season, like strep throat, urine infections, colds, rashes, flu, and things you typically go to an urgent care for.
So those things that sometimes you even have to get tested for, that's all stuff you'd be able to do at home without having to go out and kind of even expose other patients, which is sometimes what you deal with, right?
Correct. So we've gone from a small doctor's bag to a much larger doctor's kit that has the ability to test things for like strep throat and test for the flu, test for mono, test for RSV or respiratory syncytial virus that you see in kids a lot.
I'm curious, you're talking about keeping costs low for the patients. Obviously not having to worry about transportation is key, and sometimes you don't want to leave your home. How is it able, though, to drive costs down in ways that maybe we don't necessarily think of?
Well, I think that's the part of doing this. So we're going to launch in 2 markets, in South Tampa and Riverview, and this will allow us the opportunity to really learn and to innovate as we go. So what we're looking to see is where do we expand both geographically and potentially even what other services really make sense for us to deliver out to the patient's home.
I can tell both of you are excited to get this going. You said that you've been thinking about this for years. What's the feedback you've been able to hear so far when people hear oh wait, we're going old school, we're bringing doctors back to the home? What do you hear out there?
Yeah, I think a lot of people are really excited about it, and a lot of people had the same reaction that you did earlier, was we're bringing back house calls. And so if you go back to the 1920s and 1930s, there was 30% of the care was done in patients' home. And the way medical care has kind of evolved in the process, that number has gone down to less than 1%. We're trying to bring that back a little bit.
And here we are. So of course people are excited about this. Who qualifies? What do people need to know about this program if they say, hey, you know what, I think I'd be a good patient, I'm dealing with X, Y, and Z right now? What do people need to know?
It's really similar to the items that you may go to your primary care or an urgent care for, but it's really providing that convenience that they're coming right to your home.
Is the program beginning now? Have we already kicked off?
It launches today. So we did a soft launch last week, but it's live today in 2 markets, South Tampa and Riverview.
So where can people go for more information and be able to log on so that they can learn about this?
Sure, so they can go to the website, which I think is posted at tghurgentcareathome.com, and they can also call the number 813-TGH-8888.
There's the information right on your screen, like the doctor just said. Again, there's where you go for more info. Gentlemen, thank you so much. This is such a cool concept, and we're excited to be a part of the official day of beginning it with you in TGH.
Thank you very much.
Thank you for having us.